All patients with a cancer diagnosis are looked after by specialist teams made up of clinicians such as oncologists, surgeons, and allied health professionals such as clinical nurse specialists, dietitians, to ensure that they have the best care possible for their particular type of cancer. Multidisciplinary teams are a cornerstone of excellence in cancer treatment. Since multidisciplinary teams were set up nearly 17 years ago under the Improving Outcomes Guidance for Cancer, they have come under more and more pressure for a number of reasons. The UCLH Cancer Collaborative led an in-depth study into the effectiveness of multidisciplinary teams across our region. The report has made 21 recommendations, and I'm going to focus on 3. So firstly, we need to improve the quality of information presented to the MDT about each patient. This can be done through the use of a proforma that captures not only all the information we need about the patient's cancer and its stage, but also the patient's preferences, their medical condition, and a holistic assessment of their wider needs to make sure that the team can make the right decisions for the patient's cancer treatment. Secondly, we should focus on patient outcomes, and therefore MDTs need to systematically record data on patient outcomes to ensure that MDT decisions are followed through and that the clinical teams can therefore drive up standards of patient care and improve outcomes for cancer patients. One of the big challenges for MDTs is the pressure of time. We therefore need to prioritize the discussion to complex cases, and therefore those patients who fit into categories where their treatment can be along well-established pathways could have the next step in their diagnosis or treatment decided outside the MDT, but they would still be listed in the MDT agenda so that their treatment or diagnostic pathway could be ratified by the whole MDT. We believe that if the recommendations of this report are put into action, will not only release capacity and resources for the NHS, but will lead to better care of patients with cancer.